Hi, everybody. I'm Aviva Sapers, CEO of Sapers and Wallach, and we thank you all for joining us in today's town hall session. We are so glad to have you as valued clients and friends of the firm, and have worked really hard to compile the questions that you gave us in advance so that we can try and answer all of them today. Before we get started, I'd like to let you know that all the participants have been muted so we don't have any disruptions for our panelists. I also want to instruct everyone, if you can, to turn on speaker view, which is up in usually the top right corner of your screen. If you hit speaker view, then the person who will fill up most of your screen is the person who is speaking at the time. And it'll change you out of the gallery view where you see all the different names all over the place. But I think it's a lot easier to focus and you get a much better visual depending on what screen you're using to watch. And so if you have a specific question that gets answered by a specific panelist, that panelist will fill up the screen. I also want to advise, as you have questions, please add them into the chat feature and we will hold all the Q&A for the end of the prepared question and answers so that we can then get them answered by our esteemed panelists today. So a quick introduction. Without further ado, start off, we have Scott Kaplowitz, who's a CPA, the managing partner of Edelstein and Company, which is our CPA firm, and as well, a CPA firm located in the heart of Boston. Tom Jones, Vice President at AIM HR Solutions, which is a group that helps align your HR department with your business strategy to increase engagement, retention, and the effectiveness of your overall business. And Kinsley McGrath, Regional Manager of Occupational Health and Workers' Compensation for Carewell Urgent Care, an urgent care facility in Quincy, a client of ours as well, helping companies minimize healthcare costs and maintain a healthy workforce. So now, without further ado, I'm going to start by asking questions initially to, I think it'll be Scott Kaplowitz, who is our PPP expert.
Oh God, my lucky day.
Yes, this is one of the hats you're wearing today, Scott.
Yep.
First question I have for you is, what is the process to apply? Well, actually, do we have any updates you want to give us before we ask questions?
Not necessarily. I mean, a lot is changing, honestly, every day with the PPP forgiveness of debt. And so we are spending a lot of time and we're looking very closely at the frequently asked questions. So I think we should maybe just, ask some questions and then I can maybe kind of add some details.
I will launch right in. First question I have is, what is the process to apply for the forgiveness of the loan and when is the right time to do that?
So Aviva, that's a great question. I think each situation is different. You have the 8-week option and you have the 24-week option, meaning that you can request forgiveness for an 8-week period or a 24-week period, not to go past December 31st, 2020. Some clients have a reason for claiming an 8-week period. Others mainly have a reason to claim a 24-week period. Most of our clients are actually electing for the 24-week period because it allows them to spread out the timing of the payments and allows our clients to actually get full forgiveness. We did start planning, and about 2 weeks ago they came out and with the idea that you could spread the forgiveness over 24 weeks instead of 8 weeks. So we kind of took a step back and worked with our clients, and our clients are most of them are looking at the 24-week period. We do have a couple clients because unemployment is very rich right now, and they are sole proprietors, and they took the 8-week pay period because they decided that they then want to see if they can collect unemployment because their business is not going to be there. So again, that's a couple clients, but most are electing the 24-week pay period forgiveness.
Okay. What documentation will be needed for the loan forgiveness?
It's a great question. So there's a couple applications out there. One's an EZ application and one's a long form. And you're going to need documentation. Each bank will be very different in this process. And that's kind of what I'm reading up on a lot. So they will be looking at payroll records. They'll be looking to verify the number of employees. They'll be looking at potentially some rent payments. So the banks will be responsible for auditing your spend of the money.
Great. So in terms of, oops, sorry about that.
Yep.
How do you determine the 8-week or 24-week forgiveness period?
Well,
In
I
terms
think
of
it's,
how, what
go ahead.
would make you one versus the other?
I think it's your spend period. So I think it's depending if you can spend all the money in 8 weeks. What we found was a lot of our clients were actually going to have trouble spending the money, so they were going to end up having to take out loans. It really did change the planning midway through. If you look at it, we've got clients who are in the restaurant business and the construction industry, and they were unable to bring their employees back. So they were not going to be able to spend the money in 8 weeks. Now they are able to spend the money and spend it over a 24-week period. The other thing it does is it allows you for the alternative of looking at the full employment and the number of employees down the road versus the 8-week period. So there's not as much pressure to bring back employees. So that's what we're finding. We do have a client currently who actually has a fiscal year end, and they've elected now and looked at it and said they do want to spread it over the 24 weeks, and they are able to spend all of it. Whereas if we had been the 8 weeks, we would have been scrambling. What we saw was most of our clients were going to, and again, this is the majority of our clients, we're going to spend in the range of 80 to 85% of their PPP money and get forgiveness for that amount. They were not going to get full forgiveness, and now we're finding that we don't really have any clients that we're not going to see get full forgiveness.
Interesting. Are owner employees treated differently than non-owner employees for the forgiveness piece?
Yes, unfortunately they are, and that's something we've gone back and forth on. So right now, owners of S corporations, partnerships, sole proprietors are only allowed $20,833 of forgiveness, which is 8/52 of $100,000. Other employees, meaning non-owners, are allowed up to 24/52 plus benefits. So that total comes to $46,154. And they're able to get much more forgiveness. So if we look at companies who are owners, so we're a partnership, so all our partners can get $20,833. But if I have a person who's not a partner in the firm, I can actually get reimbursed $46,154 plus benefits for that person. So we are looking at sole proprietors. That's where I think you're going to see a lot of struggling, because sole proprietors applied for significantly more money because they applied for their health insurance, their retirement, and the and their 2.5 months of base pay. So most of our sole proprietors are not going to get full forgiveness based on these rules. Now, I'm not going to say that they aren't going to change again, because they change fairly frequently. About 3 weeks ago, the rules came out and said that it was an all or nothing game, meaning that you had to use at least 60% of your PPP money on payroll, and the other 40% you could be used for rent or utilities. But what happened is they actually changed that, so now it's not an all or nothing situation, so you could get partial forgiveness. So it is a constantly changing game, and we are spending a lot of time on this. And I will say that we've run into a few situations where we're advising clients who aren't clients, because it is changing. And our firm actually put aside 4 people who are spending full time, just above full time, on the PPP process and the forgiveness, and they've set up templates. And of course, we are changing them as the applications change very frequently.
Great, thanks, Scott. We will come back to you with more Q&As after everyone else as we address each one of the speakers. So hang in there. Next, I'm going to address some questions to Tom. He's going to be talking about reopening your workplace. So the first question I have for you, Tom, is what type of issues are arising around the mandatory use of masks in the workplace?
Thank you, Aviva, and nice to be part of the presentation. We're seeing at least three different issues that show up. One of them is, apart from the just general reluctance to wear masks on the part of some people, the companies can certainly require that in the workplace unless they can maintain social distancing. What we're seeing with a lot of our member companies is that in manufacturing and warehouses, it's very difficult to maintain social distancing of 6 feet. So they're requiring people to wear masks in those environments. But if people have an office door they can shut, they can stay away from other people, it may not be such a crucial issue, at least when they're working, but when they get up and go to the common areas, the bathroom, the cafeteria, other places like that, they're gonna have to wear a mask. But the three areas we see people saying, oh, it's too hot, I can't have to wear a mask, it's just too hot. And the company can say, look, we need to have people wearing masks because you have to be able to protect yourselves, coworkers. Perhaps the company can look for the best possible mask available that might be a little more easy on the respiratory system in terms of heat. Might be, and Kinsley may have a better sense if there's better mask out there or not that you're hearing about from different companies. The second one is the medical condition. People will say, well, I have asthma, you know, it's moderate to severe asthma. And that could be true. As I'll talk about a little later on, that could be true in the context of the workplace. It may be that someone has asthma and they can't work with a mask on, but that becomes part of the ADA reasonable accommodation discussion in the workplace. So it's going to be held off. And now if somebody says, I have moderate asthma, severe asthma, then you would want documentation to support that's true from the medical provider. And we actually had a doctor in one of our roundtables last week, and she made the point of saying, in her mind, moderate asthma means people who regularly go to the emergency room, not somebody who has a little bit of breathing problem when they work out, they work up a sweat. Rather, it's somebody whose life is really impacted by asthma. There's a much more significant justification for denying a mask. But even then, the company has to go through the interactive process on ADA and say, all right, this may be possible, maybe you've raised this issue, but we still can't make that accommodation. Therefore, you may not be able to work in the context. And if you can't work from home, it may be that the person can no longer work in that job. They have to find a different position within the company that they can work with, or it may be that the company can't accommodate that person. The third issue we're seeing is religion. Same argument. Some faiths will say you have to have a beard, men have to have a beard. And so the mask will be sort of put around the face and kept away from the tightness you might have normally on your face. And so same sort of issues. It could be a reasonable accommodation issue for the people involved. So again, it's part of that interactive process to determine whether or not the company can accommodate that person, or they have to say, you know, you have to work from home, or no, we can't make an accommodation.
Interesting. It gets more and more complicated. A scenario here, we have an employee returning to the workplace from out of state. The person went to one of the hotspot states and has communicated the wish to return to work to the office next week. How should we handle this issue?
Well, as it turns out, literally before we began this webinar, I got an email from a colleague at work. The governor has changed this issue regarding return to work from out of state. We used to be, we had this urge to quarantine, self-quarantine, and that applied to every state in the country. They put out a release today saying that it will apply to, it will no longer apply to the New England states, New York, and New Jersey. So if someone goes on vacation to Maine, to Vermont, to New York, to Jersey coast, whatever it might be, they then return, that 14-day self-quarantine period would no longer be required by the state, and therefore employers would no longer have to require it. But beyond that, someone goes to California, they go to Arizona, they go to Florida, one of the hotspot states, then they return to work. The urge to self-quarantine rule still remains in effect. An employer can say you have to stay home for 14 days, and that works fine. If I can work from home, no big deal, right? If I can telework, then I can do my job from home. Company has not really been disadvantaged in any way, nor has the employee. But if it turns out the person has to be at work to do their job, they work in manufacturing or they have to be in the office to do their job, that becomes a very different discussion about what they do for paying people that money. They might qualify for the sick pay under the Families First if they're being treated by a doctor. If they're seeing their doctor on that for return to work, they might be able to use paid time off. They might be able to use, I'm curious, Scott, if you've heard about this happening. some companies using the PPP money to pay people to stay home after they've been away for a couple weeks because they're still on the payroll.
Yeah,
But using,
I've heard of people doing that. They've actually been paying people to stay home. Yeah, they have been doing that.
so that's another remedy. And finally, if there's no other money out there, they could file for unemployment because there's no longer a waiting period for unemployment. The person's out of work for 2 weeks. They would be able to collect unemployment for that period of time. Not clear how quickly they get the money, but they would certainly be eligible for unemployment as well. The company said they can return to work for 2 weeks.
Okay. So, Tom, we have heard reference to some employees being higher risk under COVID in the workplace. Are there such groups, and should an employer have to do anything special about that? You started to mention masks. Different.
Pardon? Oh, yeah, mention masks.
Masks. Yeah.
And, you know, sometimes working from home is a remedy, but the EEOC recently, in conjunction with the CDC, developed a list of what they considered higher risk individuals. They generally categorize 65 and older, people who live in nursing homes or assisted living facilities, and people, and I have to check my list here, it's people who have chronic lung disease, moderate to severe asthma, serious heart conditions, immunocompromised, severe obesity, diabetes, chronic kidney disease. So there's a list of people, no matter what their age is. The first group, 65 and older, is one cohort, but any of those people with one of those conditions would qualify as well. So if somebody's in that grouping, you obviously can ask for medical documentation to say support that claim. Then that opens up the door of the interactive process under the ADA, which any employer would have to start thinking about, okay, what's a reasonable accommodation in this case? Can we make the reasonable accommodation? Obviously, in most cases, the easiest one to make is working from home, if the person can do it. Right? That's the, you know, in most setups with an office environment, that's probably more likely than not true. But in, you know, transportation, hospitality, manufacturing, that's usually not an option. So then the company has to think about, okay, what are our reasonable option here for an accommodation? And don't forget, just like any reasonable accommodation issue, you want to document whatever steps you've done, and you want to make sure that you look at the undue hardship rules apply. If the company says this is an undue hardship to make this accommodation, then you may not be able to do it. We haven't seen any real legal cases arise yet, and I don't know, it's way too soon probably in the process to see many legal cases arise. But at some point, we probably will see some challenging employers over this very issue of you should have made a reasonable accommodation and you failed to for some reason. But companies have to engage in that process. Like any other time, you want to document what you've done to show that you did the right steps in communicating with the employee.
Yeah, great advice. Recently, we've been receiving a number of requests for intermittent leave under the FFCRA law. Can you discuss in more detail what a company may have to do to comply with those requests?
Sure. This is starting to show up. We're starting to see this a lot in the summer over camps issues. And during the school year, a lot of times one parent would typically stay home full-time, work from home, maybe or work part-time at home and use the FFCRA, which is the family leave provision for daycare or for school. The intermittent leave provision is this one that says if the employer and the employee agree. So first and foremost, they have to agree over this. So an employer could say, no, we won't do it. And every so often we have hotline calls from AIM that say, that questions that very thing. We say, we can't do it because too disruptive to whatever it might be. So they'll say no to the intermittent leave. That's the threshold issue. If you can work from home, intermittent leave may apply. If you can work from in the workplace, intermittent leave may apply. So it applies principally for childcare, the intermittent leave provision. And because if someone's generally not intermittently sick with COVID, they either are sick with COVID or quarantining, or they are not. So it's the childcare issue. So you see it a lot. The Department of Labor has a really, really good detailed website as to allude to what Scott said about Treasury. They update it regularly and they don't always tell you what they've updated, but you do want to look at it and say, this has been new information, but specifically questions 20, 21, 22 deal with intermittent leave and the nuances around intermittent leave in quite a bit of detail. It's really worth looking at.
Okay. We have reached a situation where some of the people we furloughed will not be called back in the foreseeable future. What, if anything, do we have to do about that? By the way, these are not our Sapers and Wallach questions. These are from folks who are on the calls.
These are risk. The risk here is by refusing to call people back, the risk that gets raised is there age discrimination going on? So just like we said, there was a list of cohort of people who were potentially subject to the EEOC standard. As you start to look at your list of calling people back and you say, gee, so-and-so 65, so-and-so 65, we're not calling them back. It's just too much risk. That begins to look like a question of age discrimination. You know, if their position's been eliminated, fair enough. If something else is going on in the company, they're lower down in seniority, years of service, perhaps that's a different argument. But in general, to just say unilaterally, well, this person's too old or too high risk for us, runs a risk of looking like you're making someone a target of opportunity and using that as a way to discriminate against them. So you want to be conscious of what's your reason why you're not calling that person back. A valid business reason for doing so.
Thanks, Tom.
Yep.
Kinsley, a couple of questions for you. What are the different testing options available for employers?
First of all, thanks for having me today. So right now we're seeing employers use two types of testing, swab testing, which could either be PCR send out to a lab like Quest, or if your customer like Carroll Urgent Care has an in-house rapid, that is still a swab test. So 2 swabs for the rapid virus testing, and then antibody testing, which was a big buzzword in the beginning. And right now for MMR, for Hep B, for varicella, we use titers actively. The difference is for those type of titers, we have a level at which you reach immunity. And right now we know that we don't have that level yet. So the other fallback for antibody testing right now for employers is that it only comes in as negative, positive, or inconclusive. So for employers who are working actively around droplets, if you're a dentist, doctor's offices, or you're in an area where you're going to have your employees working in a COVID-19 positive area like a nursing home, antibody testing might be effective for you. If not, you're probably going to go into the active virus swab testing.
Super. And what are the different types of testing patterns, exposure, reentry, et cetera?
Yep, so we've seen employers who are coming back to work fully test all employees for a baseline negative, and then working off of exposure testing. So if you're a company that works along other companies for construction or other areas, and you can't manage that company as effectively as you can yours for safety precautions, you might need to exposure test more often, or again, symptomatic testing, obviously. Anytime any of your employees are symptomatic and they want to return to work, we're seeing testing done that way.
Got it. Do employers have to send employees to a testing center, or can it be done in-house? And are the tests different?
So right now, we can come on site. So we have, again, 2 types of testing. You need to work with a CLIA-approved lab to do the rapid testing, and we can bring the Quest swabs. The only difference right now, the sensitivity, which means how many false negatives are you going to have if someone tests negative? Is that a real negative or is it a false negative? They're very similar right now for the rapid and the send out. That wasn't the case about 2 weeks ago. So they're actively always developing these tests. So the Quest in-house sensitive, the one that you send to the lab, is 100%. The rapid is 93.8. So Carroll Urgent Care has a CLIA certificate for every clinic, so we can come on site with the rapids. You're just kind of going to have to make sure when you reach out to individual companies that they can provide the rapid.
Okay. And in terms of how often should employees be tested? Should there be some regularity to it?
So that goes back, I think, to what Tom was saying. Are you working with a demographic that's predisposed to this? Are you working around, if you're in an assisted living home, I know that the regulation was there, that there was more of an active need for testing. Right now, the regulations are right now from the DPH, it's just exposure or positive. But it's, I think, dependent on the demographic your employees work with. Are you able to take those safety measure cautions like Tom was talking about? Are you able to stay 6 feet away from each other? Are you able to wear a mask? And if you're finding yourself where your employees are more exposed or they're working with the predisposed demographic, you're probably going to have to test in the higher numbers.
Okay, so that's the conclusion of the previously submitted questions that were sent in advance. And we're going to open it up to the ones that have been put into the chat as we've been talking. But before I get into that, I first wanted to thank our panelists for taking time out of their busy schedules to be here and to help us out. So first question that I received was, I guess it's for Scott, if we choose the 24-week option, can we apply for forgiveness early?
Can, and that actually is very recent. We just got that guidance in the last few days. At first, we thought it was 8 weeks or 24 weeks, but you can choose to apply early. You just want to make sure that you have your ducks in the row, and when you pick that date, you want to make sure that you've hired back the right number of employees and do the planning to get full forgiveness.
Okay. And what are the best practices to track your expenses?
Great question. So we've had different clients use different systems, anywhere from an Excel spreadsheet to setting up a separate bank account and transferring the funds from that separate bank account into their operating account, and only transferring the funds that cover the costs in the that are PPP reimbursable. So we have a client, great example. We literally went through their weekly disbursements on payroll and identify what qualifies, what doesn't, who makes over 100 grand, and they've got it set up and they're transferring the money into their operating account on a weekly basis.
Okay.
That's great.
To start, but I have
Somebody put on mute that's not on you here.
please.
Who makes the determination as to whether the loan will be forgiven?
My understanding is the banks are going to be making that determination. And I assume they'll be working in conjunction with the SBA and required to put certain documentation together, like we discussed before. But my understanding is the banks, and I think they're going to be potentially, there was talk they would be actually engaging CPA firms to assist in the process as well.
Okay. And what can be included under the utilities portion of the forgiveness of the PPP loan?
Utilities, so you can use cell phone, internet, electricity, gas or fuel. There's another item called transportation costs, which I keep on saying this, we don't have any idea what it means. We think it's transportation of electricity, but right now it looks like those are the main things that you can seek reimbursement for.
Okay. Is it necessary for people to wear gloves when using office equipment or touching things in common areas?
Is that for me?
Probably.
Oh, that's definitely not me.
That's probably Tom, I'd say.
I mean, it may, in my mind, and Kinsey, I defer to you too, probably more detailed. I think it's going to depend what the workplace is like. What's the nature of the work and machinery? I mean, gloves. I mean, respiratory disease. Generally, it's, you know, your hands is focused on washing your hands to make sure that they remain clean throughout the course of the workday. But I mean, people do wear gloves in supermarkets. You see it in other environments where they're interacting and touching a lot of things over the course of the workday. But someone's sitting at their desk where they may just be using their own computer, and perhaps less of a reason for a glove. But if we all shared a computer, we were all at the front of a store and we all shared a computer to type in information, you'd want maybe everyone wearing gloves or some sort of plastic shield on that to make sure that, you know, we weren't inadvertently spreading germs from each other.
Okay. Back to Scott for a second. Can you give a quick overview of the benefits that count for the PPP loan? Will life, disability, or long-term care count?
Unfortunately, those costs are not allowed. So you're really looking at healthcare, retirement, and dental insurance really cover what is forgivable under the PPP loan.
Okay. And then I have a question here. Should our company have a written COVID return to work policy, and would we need employees to sign it? It sounds like that's for Tom.
There is one, and the state has put one together. It's sort of checklist, a 2-page checklist that we'd encourage all employers to look at and can download off the state website. Sort of walks through the different things you should have done about cleanliness in the workplace, cleaning crews, how you've arranged for social distancing, what steps you've taken as a company. So we definitely encourage employers to download that list and follow it through in the workplace. As to having each employee sign off on it, as I recall, you have to put posters in the workplace to inform your employees what steps you've taken in the workplace. And so there's an attestation form that the employer has to provide, but I don't know if anything off the top of my head right now that says you have to have an employee sign off on each one. Kinsley, have you seen that at all? Have you seen that?
I've not seen the requirement. I have seen the posting of the safety.
I wonder, I mean, people aren't in the office, not going to see it anyhow. So it would probably have to be something sent out electronically, and I'm not sure everyone has the kind of signature ability that they need to do things remotely. But that's a good question. We'll have to get more information on that. The costs, let's see, what else we had. We already answered that the cost for business owners healthcare, business owners healthcare, Scott, is that covered under the PPP? I think the answer is yes.
So it depends. But if your compensation is above, it depends. If your compensation is above $100,000, you're limited to the $20,833 for the business owners. So again, I'm a business owner, so I can't get my health insurance covered. Because we elected to do the 24 weeks, I would then be covered for up to $20,833 in total costs for me. So unfortunately, that's the cap right now. And I'm caveat that by saying that that's right now. When we first started this PPP application process, we actually interpreted it that way. But then when you did the application, they actually allowed you to include some other benefits, including the health insurance retirement for application process, but they're not allowing it for forgiveness.
And there was a second part to that question. Are the costs for monthly charges for cloud-based software used for businesses like database, cloud storage, etc., considered rent under the PPP?
That's a good question. I honestly don't know the answer to that. I haven't seen anything that would lead me to believe it was yet.
Okay. Someone asked if we could confirm that the payroll cost limit of $15,384 is just payroll for forgiveness and doesn't require health insurance in the limit.
I would need some clarity, but I think what they're saying there is the $15,384 would be the 8 weeks forgiveness amount versus the 24. And I believe that what they're asking is that all inclusive? And my answer is yes, under the new guidelines.
Okay. And then Scott, can you confirm that if you apply for forgiveness after the 12 weeks FTE on December 31st does not count?
Correct. The 1231 is a safe harbor.
Okay. And then the current status of federal audit for loans over 2 million?
Again, I haven't heard anything about that in a while, but my understanding was that the 2 million was going to be everyone over $2 million was going to be audited.
Okay. And then has clarification been made that the use of mortgage and utility would require the organization to meet the compliance requirements such as Title IX for the life of the mortgage?
I'm not sure on that, to be honest with you.
Okay. I think this next one might be for Kinsley or for Tom. Should you have any type of temperature testing device at your front door and test everyone's temperature coming into the office? Or is it just restricted to employees?
Kinsley, you want to go first?
Yeah, so, we're dealing with the issue of that this is sometimes a non-symptomatic virus, or even though there was data coming out that non-symptomatic infected employees are going to have a lower viral load, which might mean lower contamination. You can't tell the difference between pre-symptomatic and non-symptomatic. So temperatures are definitely one of the symptoms, but you have a whole list of symptoms: fever, lower respiratory, fatigue, sore throat. GI happens in 20% of people. I know a lot of employers are doing temperature reads. I think it helps tracking the symptoms, but I think it's one of many symptoms that you have to keep in mind are associated with this.
Okay.
We have been seeing some member companies do just that. They'll stop people at the front door and say, and have a little tent and do a little the scan with the little pistol to check that out. So some people are doing it, and they're doing it as well for customer and what do you call it, vendors coming on the property, you know, the FedEx people, the UPS, any of the quote unquote strangers to the workplace coming in as well.
Tom, are you seeing that most companies are not allowing visitors? So like right now, I'm actually going to go meet with one of my clients in the back of his pickup truck downstairs to go over his tax stuff, because we have a prohibition against visitors in our office.
Yeah, very much so. The people who are going to offices, you've got to have, we've done the same thing in our office. You've got to be able to say to people, what's your explanation for being there?
Mm-hmm.
Can you do it? Can this not be done remotely?
Mm-hmm.
You know, what other alternative remedies there? So many employers are shifting in that direction, if at all possible.
Mm-hmm.
Okay. Question, how quickly can employers get the COVID testing results through Carewell?
So the rapid test is in-house 15 minutes. So employees will leave with the results in hand, and we should, depending on the volume, be able to fax it to the employers as long as the employees signed off to release it to their employers within the day.
Okay. There was a little clarification, Scott, on that mortgage question. I think you may have still said you didn't know the answer, but it said, has the clarification been made that the use of mortgage and utility would require the organization to meet the compliance requirements such as Title IX for the life of the mortgage?
I haven't seen anything on that requires that. But again, it doesn't mean anything. I probably haven't been that deep into the details on the mortgage interest forgiveness. Most of our clients are paying rent, so I haven't seen that. But again, I have not seen a requirement like that.
Okay. And then what is the testing protocol that Carewell is recommending after the baseline? Would it be for all employees, frequency, and the cost to do something like this?
Again, so it's right now going to be employer discretion unless you're a nursing hospice that has a regulation through the state. And the cost is on the employer for non-symptomatic employees at this point. Symptomatic employees can be run through their personal insurance.
Super.
So
And,
yeah.
Go ahead.
So I was going to say it's hard because there's no set guidelines. Usually with OSHA and with DPH, we have all of these set guidelines, regulations. And right now you really have to take a step back and think, how exposed are my employees and the demographic that they're working with? Because you not only want to keep in mind, you know, the spread of contamination within your company, you also want to cautionary to spread to the demographic you're working with. So again, if you're working with a higher demographic, if any of the lists that Tom listed out for how you'd be predisposed to this, you maybe want to bump up your regulations so that we can control the exposure.
Super. And then I think this is probably for Scott, can you use the alternate payroll period and apply for forgiveness after using the loan over a 12-week period?
I believe you can.
Okay. And then can you use the alternative payroll period? If you choose a 24-week forgiveness period and you furlough people after you reach the full forgiveness amount, will they receive full forgiveness if you bring them back before December 31st?
I believe you will, because the December 31st is the safe harbor date.
Okay. Are there any other questions from the crew? Because I think that's all that I've seen in the chat box.
Eva, can Kinsley, I don't want to put you on the spot, but I have a curiosity, a question about, you folks do workers' comp issues too?
Yep, we support workers' compensation. Actually, we work very closely with employers to make sure they go back to work if they have modified duty.
Are you starting to see complaints of injuries from home?
No, actually, I haven't. So, well, I have 4,000 employers and 17 clinics, so I usually field all the calls. I can say I haven't gotten a call about it. I can't confirm if we've seen anyone in-house, but I usually get a call from new instances like that, so I can look into it, and I have not received any calls.
We're
So
sort of
actually-
anticipating that happening at some point in the future.
Tom, we'll check with our P&C folks that do the workers' comp insurance and find out what they're saying on that front, whether you're even covered for that. It'd be interesting to clarify that. Maybe we'll get the answer to that sent out when we, for those who want to see a copy of this recording. And then someone just submitted, should you have staff sign a liability waiver? Like when they, I'm not sure if it meant specifically this, but when they come into the office saying, yep, I'm feeling great. I've got no cough, no problems going on, that sort of thing. Do you have people sign off? Obviously bring their own pen, but should they be signing something when they come in? Some sort of liability waiver? Or maybe even for the workers' comp, it might have even been tied into your question about workers' comp.
If you have someone sign a waiver, you sign a waiver affirming they're healthy at that given moment, and based on the most recent evidence they have, which, as you would know, Kinsley, it changes like quickly.
Yeah.
So I don't know how much it would help. You know, if I say, well, okay, Kinsley, you're healthy today according to this waiver, but you're gonna in the morning you're sick by the end of the day for whatever reason.
Yeah, this goes back to the discussion we had. It's kind of hard to find where the virus was transmitted. So, you know, they leave your company and they go to the grocery store. How do you differentiate where the virus, where they contracted the virus? I haven't gotten questions about that yet. That's a hard one because if you're coming to work, there's going to be a risk of exposure, and I think that's why testing is so important. I know that, you know, in the beginning, the reason why we invested in a rapid, which was a cost for us to invest in, was so that we could give the employers a discounted rate than the Quest, because we were, you know, relying on their cost to us. So that was one reason we bought into it, but also so you could get quick turnaround time, because we know, you know, it's really important that we have testing availability for everyone.
And did you answer the question about what it costs to do testing for companies?
The cost is, so right now through insurance, you can run the symptomatic tests, and then the cost to employers for self-pay, it varies based off of volume. So that's an internal discussion we would have together about how many tests you think you would have, because I can give discounted rates on volume.
Okay. And is considering, switching gears here, back to, I think, Scott here, is
Yep.
considering 25% payroll reduction, in considering the 25% payroll deduction, how do you count people who are furloughed and invited back? How do you count teachers who are off for the summer?
Well, teachers who are off for the summer, I would say, are still, in effect, seasonal employees, I would assume. So they would still be considered employed. As for the furloughed people, you do need to bring them back before the measurement date. And obviously, you know, I guess, you know, you have a furlough and you have the 25% reduction and you have to go employee by employee. But I'm assuming that if you bring them back, I think that's what the person is asking, then they would count as being brought back for the head count purposes.
Okay. I think that was all the questions I've received. So I'm going to end a few minutes early. We're going to thank our panelists.
Thank you.
And thank you for Scott. If someone wanted to get in touch with you at Edelstein or remotely from
Yep.
Edelstein, how do they do that? How do they contact you?
My email address is very simple. It's sbk@edelsteincpa.com. And if you go to our website, it's edelsteincpa.com. You can find my information on there as well.
Super. And Tom, how would people reach out to you if they had they wanted to either join AIM or do something with your
Two
organization.
ways, and you alluded to it right there. We're a membership organization. If people are interested in joining, there's one of my colleagues, a guy named Tim Blaney, Blaney, who I can get you his email, and you can reach out to him to learn more about what membership means. Or you can just write to myself, tjones@aimnet.org. AIMNET is one word, .org. And so I'll give you more information. We run a hotline. We do a lot of educational things as well to try and keep our members up to speed with what's going on.
Super. And Kinsley, if someone wanted to get in touch with you or Carewell Urgent Care, how would they contact you?
Yep, you can reach me by email. It's my first initial last name, so K McGrath @carewelluc.com, and UC is just the abbreviation of urgent care.
Super. And if for some reason you guys didn't catch all that, you can reach us and we'd be happy to get you their contact information. So I want to thank everyone who joined us today for this town hall. We only have them when we think there's good or new news to share, not always good, but new news to share. And we try and bring value add to be sure that you're getting what you need to help find a way to survive through this whole crazy pandemic and the new norm of whatever that is that keeps evolving for us. I wanted to thank our speakers again and just let you know we're all in this together. Our Sapers and Wallach Hill Group of New England team and our wonderful network of specialists that we have will get us through everything as best we can. We're really here to take care of you and to help support you. So we wish you to stay well, stay safe, and don't hesitate to reach out if something arises that you are struggling through or that you're facing that you might need some help on. Thank you now for being part of this, and I think that will conclude our presentation. If other questions come up, you can reach us and we'll see if we can try and help get the answers for you. Stay safe and stay well, and thanks everybody.